Hello, and welcome to today's virtual program hosted by the Healthcare Council of Chicago, HC3. My name is Megan Phillip, and I am the Executive Director of HC3. We are a mission-driven platform proactively seeking uncommon alignment to improve Chicago's healthcare ecosystem. Today's program is the third installment of our Role of Women in Healthcare event series with some inspiring civic-minded leaders that are promoting and advancing economic, health, and wellness opportunities in our local communities. Before we dive in, I have two housekeeping announcements. This afternoon's discussion, or this morning's discussion, I should say, will be recorded and shared on our website, www.hc3.health, for later viewing and sharing. And as we hear from today's experts, please use the chat function, which will be seen directly by our moderator, to ask any questions you have throughout the program. It is now my absolute pleasure to invite our special guest to join us and for me to hand it over to our moderator, Lori McGraw, who's the Senior Vice President at the American Medical Association and host of Inspiring Women, a podcast with Lori McGraw, where she interviews women of all stages in their career to explore and share their professional journeys. So thank you all for being here. And Lori, you can take it from here.
Thanks, Megan, and thank you to the Healthcare Council of Chicago for hosting this series. This has been, just a terrific set of conversations. As Megan said, this is our third conversation. Today, we're speaking with three exceptional women leaders of organizations in Chicago. I'll introduce each of them, and then we'll hear about each of their organizations. But this is our third one. We kicked off this Women in Leadership series at the JP Morgan conference earlier this year. We spoke to women in the area of innovation. The second one was an installment talking to women leaders of healthcare organizations, again, in the Chicago area. And today we're speaking with women executive leaders of organizations that are serving the local communities of Chicago. So we have Aisha Jaco, who is the executive director of Westside United, and I'm delighted to be speaking with Aisha this morning. We have Selma Sims. She's the CEO of Gardeneers, which is an organization that is working on food justice, and we're going to hear about the important work of Gardeneers. And we have Linda Tortolero, who is the president and CEO of Mujeres Latinas in Action. And we're going to be hearing about her organization, which she said was 50 years old now in terms of the work that it's doing, maybe even longer in terms of help for women, domestic and violence, as well as immigration and other women's health issues. So good morning to all of these women executive leaders. I'm delighted to be speaking with you this morning. I did the quick introductions, but maybe Aisha, I could start with you to talk a little bit about yourself and Westside United.
Sure. Good morning, everyone. So I am a Chicago native, born and raised on the west side of Chicago, and therefore extremely honored to serve as executive director for Westside United. Ironically, the community that has the lowest life expectancy is where I spent a large chunk of my childhood. So experiencing firsthand what it was like to have the food and liquor store be my family's grocery store, experiencing firsthand high rates of violence in that community and lack of access for a variety of reasons. So coming into this space, fast forwarding to where I sit today in 2022 and thinking about our work at Westside United and its aim around decreasing the life expectancy gap, because if you live in Garfield Park, data shows that you're more likely to have a lower life expectancy. And we all know if you get on the blue line, green line, drive down Madison, Washington, Jackson, from downtown into these communities, you see a shift in resources and what the housing stock looks like, what the grocery stores look like, what schools have available compared to other areas. And so the work of Westside United is really leveraging hospitals who have our 10 communities in their backyard and their ability to hire locally, to think about how they can route investments to these communities and help jumpstart activity in some of the corridors that haven't been touched by a united front since the riots in some cases in 1968 related to Dr. King's assassination. So there is a lot of work that we know that we need to do collectively. And so the work of Westside United is really around channeling resources, primarily from health systems who over the past 100 years have been competitors, coming together to say, we will commit to hiring 4,500 residents from the West Side by 2023. We will commit to investing $42 million in capital through our partnerships with community development financing institutions to ensure that affordable housing needs are met across our 10 communities, that nonprofits that are working in this stratosphere of helping to bridge the gap have access to do capital improvements, et cetera. We also look at the healthy food landscape. So right now we're working very closely with West Garfield Park and their aims to get a grocery store there now that Aldi's has recently closed and Save-A-Lot. So in our work, you know, it really takes me back to where I grew up in a community that didn't have these resources, but to come back with a jumbo jet or turbo engine of resources, given the intentionality of our healthcare partners and our partners like the American Medical Association and others that are really committed to helping us think through a comprehensive approach. Another piece in our work is looking at, you know, how we address maternal child health disparity, how we address hypertension management across our areas. And so it really is an all hands on deck approach, thinking about how we work with city entities as well when we think about COVID and the disparity and what was exacerbated because of COVID. These were things that we already knew. So this all hands on deck approach is very critical to our work. And again, my passion as a former resident is really a driving force for me personally to ensure that we meet our mission.
Well, the passion and the urgency of the issue is apparent. 14-year life expectancy gap, and Selma, you called it a death gap in terms of just really to underscore the urgency and the magnitude of the problem is important. We're going to dive into that because while 42 million and 4,500 hired resources sounds like a lot, I want to talk about, you know, like how large these problems are and why it's so important for each of these organizations to be doing the work that you do. So with that, Selma, let's maybe talk about Gardeneers and what you're doing there.
Okay, good morning. My name is Selma Sims. I'm the CEO and head grower at Gardeneers. We are a nonprofit located in North Lawndale, but we do customized school garden programming on the south and west sides of Chicago. We specifically dedicate our resources towards the south and west sides because historically, systematically, and systemically, these areas of our city have been kind of pushed to the wayside. And we understand equity is all about filling in those areas where people will accept our support, right? Because that's what equity is about. You don't want to force yourself on people. We as Gardeneers, we specifically focus on youth education because we understand that in the areas that we have, of course, due to historical reasons, and systematic reasons, and this conversation today about medical, how it relates to our medical impacts, we know that inadequate access to healthy foods is one of the reasons that depth gap that Dr. Ansel from, I think it was Sinai, he coined to describe the life expectancy gap in the neighborhoods that we serve. I think North Lawndale, it's anywhere between 14 to 16 years that people will not get to see, all because of hypertension, diabetes, high blood pressure, health issues. They're health issues. Most people think it's the gun violence. And yes, that is a factor, as Aisha mentioned, but when they sat down, they looked at the numbers, 60 to 70% of the deaths in these areas were health related. And so we understand if we start young, and I hate to use this old adage because it's not true in all cases, you can't teach an old dog new tricks. You kind of can, but we start with the youth. We know that by impacting youth and through youth education, we are able to mobilize several different outcomes. One, our youth, by growing the food that they will eventually consume, gain a greater appreciation. We know from our data that youth that come through our programs, they increase their vegetable intake by 1 portion per week, right? It doesn't seem like a lot, but it's phenomenal because we know that youth that increase their vegetable intake now, who decide to be open-minded about the palette of the types of food that they eat. They become adults that do the very same thing. Those adults become educators, instructors, parents, mentors to future generations. And so that's why we do that. Also, by doing garden education, we're able to, and with the schools, we are able to provide food with as frictionless as possible. So the produce that we grow in our school gardens and on school property is never sold. It's all free. We set up farm stands and we make sure that our school communities have first access, or first refusal, if you will, but it is open to anyone in that community that comes to that farm stand. And that's another way we're not only impacting youth, but we're able to impact our communities. And we know, we hear it, and like it was mentioned before, we've had several large chain grocery stores close in our neighborhoods. And so although we know we're not making a huge gap, we're never going to be able to fill in that void. We hope that by doing this type of education, people will understand the sense of urgency as to why we need to push back on something like that happening, why we need to support our local grocers who want to come into our neighborhoods. And so that's really what we do here at Gardeneers. We're youth education that's garden-based, also that we can have a positive impact on nature, nutrition in the community, as well as our overall American agricultural food system.
Thank you so much, Selma. And 2014 is when Gardeneers started. Is that correct? So it's, you know, in the scheme of organizations, it's a relatively young organization.
We are relatively young. And yes, 2014, we're small org. We have less than 15 staff members. We made it through COVID. But yeah, we're still, our staff is young. I think our oldest, our most senior in age staff member, he's about to be 40. So we're young all the way around, but we're making it, and we just really care about the youth, and the youth see that, and we hope our community see that as well.
And we're going to talk today about impact, because in the importance of the impact of these organizations in terms of what you're doing and what in your community. So thank you for that. Linda, let's hear about you and your organization.
Sure. My name is Linda, and I am the proud president and CEO of Mujeres Latinas en Acción, and we provide services for survivors of domestic violence, as well as sexual assault. We're one of Chicago's rape crisis centers. We also provide services for parents who want to receive more assistance as to how to be better parents, stronger parents. Many of these parents have experienced domestic violence in their homes. We also offer supervised visitation and safe exchange for those families that have had court-mandated visits with their children. And we're one of the few providers of that in the city of Chicago. We also do leadership training. We believe it's very important that our survivors, as well as other participants in the community, learn about civic engagement, receive a political education so they can be active in their own communities. And we also do an entrepreneurship program, many of whom are domestic violence survivors, others who are not, who are want to start their own business or would like to expand the business that they currently have. We believe that for many survivors, providing them access to be able to become more financially independent will increase their economic well-being and give them choices as to how they can be safe and thrive on their own. And these programs have been, critical to us in terms of the way we want to support women in our community who are the backbone of our families, the households, the communities that we live in. And we have found that it's really helpful to do this kind of multi-tiered approach for helping survivors of gender-based violence in a culturally specific, culturally competent way. One of the things that we have definitely seen is the rise of domestic violence across the globe, not just in Chicago, sadly. And we have been making sure that we can do as much as we can to provide services during this time. One of the things that a lot of folks don't understand is that domestic violence can be a root cause for community violence. We see this effect over and over again. For instance, survivors who've experienced forms of violence, we have shown that those that have been violent at home can also be more likely to perpetrate violence in their communities. And so that for us is really important to kind of lift and acknowledge. Domestic violence services are vital for public safety, and we need to do more as a city and as a state to invest in those services during this time. And that became really critically important during the pandemic. One of the things that we continue to have to lift is that oftentimes services for women and girls are really underinvested in as a society, especially those organizations or programs that are led by women of color. Philanthropic studies have shown that women of color face increasingly greater challenges when it comes to fundraising. And so when we're trying to design and maintain and survive, so during these times, those kind of barriers are even exacerbated more during a pandemic. And so I think one of the things that we will continue to do is to make sure that we can provide survivors as much education about their safety as possible, but also options to live their own lives as they see fit. We think that, a first voice perspective is important to maintain, but also making sure that survivors feel that they are independent as much as possible to make difficult choices to persevere.
Thank you, Linda. So listen, these missions of each of your organizations are working on pretty significant problems, significant social problems. So I want to dive into, more of that. But before we even do that, I'd love to hear a little bit more about each of you as leaders. What did it take to become the leader that you are today, leading these very, very important organizations? So Linda, can you start with, just maybe a snippet about when did you know you had this leadership capability to lead such an important organization?
I think I've been really fortunate since being a young person, to be told that I had a voice. So, having parents instill that in me is really, such a gift. And I'm so privileged to have had that gift. I think the other thing that I saw too is that, there are many folks in our community that are doing amazing work, and we have to acknowledge that. But sometimes it's very difficult to be in a position to, raise your voice and stand up for something that's really important. And I'm actually an attorney by training. And I think that was one of the reasons why I wanted to go into the law. And now most of my work is, nonprofit management and advocacy, is that I felt that I had a voice that needed to be heard. And I also found that I could help others make sure that they're getting the attention, the services, and the respect that they deserve in terms of making sure that the needs that they have to be successful are being met.
Yeah, so many women that I speak to, sort of finding and the awareness that you have a voice and then how to use it. But people often speak to their parents as that first inspiration, for the confidence building. Selma, what about you in terms of a sort of a moment you knew?
I have to steal from Linda. I had a voice from a young age. I went to military school, so just leadership was one of those things where you did it. I went to Chicago Military Academy, Bronzeville, and in Bronzeville, it was the first public military academy in the United States. And so I just knew I wanted to be a leader, and I just needed a system to guide me. And so I knew leader was a thing. I wanted to lead, but how I wanted to lead and who I wanted to lead, I learned that through the Chicago Park District. I worked with the Chicago Park District for almost 10 years. In my early to late teens, early and mid 20s, and then agriculture. So youth development. I wanted leadership. I wanted youth development because one thing that I have seen in various instances, I feel like our youth are seen as not necessarily a problem, but they are not a concern until they are a concern. And that's not how we should treat our youth. Children should be seen and not heard. And it's usually when you hear them, it's a problem. And it's no. And so knowing that I wanted to lead, seeing in the Park District how that youth development it's very instrumental for our society. It's very devalued, but it's important. And then just understanding in the neighborhoods that I live in, access to food, and of course, agriculture, because I am a formally trained agronomist. So I attended Iowa State, I'm minoring in horticulture and Spanish. I knew I needed to figure out a way to get all three of these things to align, and Gardeneers just happened to be that thing. And so I lead youth development and agriculture. And so, yeah, different points, but it got me here.
Well, and a lot of things coming together there, and just you can hear the passion and energy behind what you're doing. So thank you for that. Aisha, what about for you?
I have to echo both Linda and Selma. You know, my parents, for my father, it was almost a prerequisite to make your community better than you found it. And for him, his model, he was an engineer, but his passion was the martial arts. And so he would go to different communities like Lawndale, South Shore, and open up karate schools and take some of the baddest kids in the neighborhood and turn them into saints. So it was just amazing seeing that model. And so as I thought about what I would do and what my contribution would be, I fell in love with the arts. And similarly, found programs like Gallery 37 that trained me, to be a professional dancer at one point. And I used dance as my vehicle. So from elementary school up through college, just always finding those leadership roles that allowed me to bring in the arts, have that youth development focus as well, and to change lives like my dad did during the martial arts. And that eventually, translated into social service opportunities, founding an organization, leveraging hip hop culture, but looking at food access, looking at global capacity building for young people, that had a citywide focus. And ultimately, actually, Selma, David Ansel, his book, The Death Gap, also had impact on me because I picked that up later in life and was like, oh my gosh, who is this guy? And happened to know that he was a founder of Westside United, and I sit here today. So, it was also these pivotal points in my life and journey through my parents and other key stakeholders that brought me to where I sit today.
Well, it's also interesting just to hear from each of you how, leadership, sort of, finding the voice came from involvement in community activities at a very young age. So, not just sort of a parental influence, but your own involvement, whether it's dance, the park system or whatnot, how that influenced you and sort of, brought your connectedness in terms of the communities that you are serving. So let's maybe go back to, the impact of your organization. So, we talked about the life expectancy gap. We talked about the growing need, the growing unfortunate problem of violence that is growing globally. Linda, as you talked about, first of all, why do we need your organizations? Why aren't the public resources, the infrastructures through governments and other things enough? And just maybe we could just hit on that because again, these we all have awareness of these problems, and yet so much is still there. And the word, each of you I think used the word systemic as some of the built-in reasons, but maybe we can speak as to the why. And maybe Selma, I could start with you.
That's a great question. Thank you so much for asking it. Well, one, I think as an agronomist, our organization is needed because agricultural education is not a priority within urban areas. Everyone knows about food insecurity, or the term we used to use, we no longer use it anymore. Some people still use it, food deserts. Food deserts are both in urban, peri-urban, as well as agricultural settings. And most people don't think in agricultural settings, they think in the city. And so once we think about why that is, it's usually because we are not well informed about the supply chain as it pertains to agriculture. We are not adequately educated about who produces our food and how much effort it takes to get to us. And so that's something that I noticed when I was studying in Iowa. Agriculture education, it was fully funded by both the state and the federal level. There is legislation written into constitutions that make sure agricultural education is fully funded. We still have Future Farmers of America, which is FFH. We still have 4-H. Both of those organizations, I think it's 2022, they'll be, if they're not 100 years old, they'll be at least 100 years old because they're New Deal organizations. They came about with the New Deal era. That's why our organization is important, because in Chicago, we only have two educational facilities that are focused on agricultural education in the city. That is the Chicago High School for Agricultural Sciences. all the way on the southwest side, or the Gary Comer Youth Center, which is located, it's right up the street. It's right there on 71st in South Chicago. But what about the rest of our youth who want and need to know about these systems that are important to their everyday lives? And so that's how I look at it. A lot of budgets have been altered. And so unfortunately, things such as garden education, agriculture education, it is not prioritized like other things. And so that's why we're important. That's why our work is important. And that's why we are always and grateful for support that we get.
And it's impressive just, how you're following the education line. Look, there's been education. It's not been enough to meet the need. And even though Gardeneers, provides the food in the local community, you're so focused on the education of the youth. That's just really incredible. So Linda, what about for you? And I forget, I think I've got the number of years wrong. Is it 50 years for the organization, or is it 75?
No, we're going to be 50 next year. So we're gearing for our 50th anniversary campaign, but yes.
Impressive.
Shout out. I think that there is just a fundamental problem in our society that, and I kind of hinted at this earlier, that we don't value women and girls enough in our culture. And I think that is reflected in the investments that we make in terms of women and girls. And I think women and girls of color are even facing more challenges in terms of the services and the programs that they deserve in order to really succeed in life. I think the other thing too is that folks still are very confused or don't understand the prevalence of domestic violence and gender-based violence in the community. These are things that we still don't talk about enough. We are not encouraging our young people to think about what it means to be in a healthy relationship, that power dynamic. We still live in a society where those that identify as male feel that they have power over those that identify as women. And this really manifests in the way that we prioritize what's important in our society. I think one of the things that we're, definitely in addition to making sure that we understand that domestic violence is a root cause, one of many, of community violence, is that we need to make sure that folks understand about generational trauma, that this is something that we carry. If a child is exposed to domestic violence or sexual abuse, if a mother is exposed and the children witness this in such a way, it can be devastating. And I think that we need to think about how do we both address the misogyny in our culture, but also making sure that we are talking about how we can invest more in making sure that generational trauma does not happen for anyone in the United States. And I think that that's something that, once that commitment is made, because increased awareness and understanding is, more prevalent, I think that we will see better results. I think also too, it's when we kind of shift the paradigm, I'm hoping that, folks will be more honest about what is important to them when they talk about what they've experienced, because it's very difficult to share stories of survivorship. And I think the more that we talk about that, in a way that, again, is not triggering trauma, but respecting the lives that they have lived and honoring the fact that we want to make sure that we do better, in terms of our investments and our priorities.
Well, it's also one of those silent problems. Okay. So, in terms of domestic violence and the stigma and shame that can come from that. For Maheros, does your organization, like Selma's, focus on education as much as it does on the counseling and all of the other things that you were talking about before?
No. And that's a problem. There is more, and this is something that our staff will tell you, and any other staff member at a domestic violence or sexual assault organization will tell you, is that a crisis intervention, absolutely necessary. We need to make sure that women and children are in shelters, that they have food to eat, that they can get to a safe place, that we can create a safety plan, always. Get an order of protection, always. That needs to be prioritized. But where is the prioritization in schools? So I think educating young people about healthy relationships, about safe touch, bad touch in schools is something that is still not done to the scale that we should be doing here in Chicago and Illinois. So prevention is definitely underfunded.
Yep. Okay. That's really, really interesting. And so Aisha, you talked about just like the urgency of, just needing all hands on deck for the life expectancy 14 to 16-year gap that we were talking about earlier. So why aren't the health systems in those communities enough to deal with the problems at the magnitude that we're talking about here?
Sure. The health systems are not enough, but they are a starting point. They're not enough because the entities or institutions that got us to this place span in housing, when you think about contract buying, and a lot of the historical discriminatory practices that got the communities in the shape that they are in now, it cuts across various sectors. And what we do at Westside United, we're a starting point where we have commitments from healthcare to say we need to do better. We need to serve communities in our backyard who, since our existence, we've just treated them and not looked at collectively holistic practices in which we can make their quality of life better. If we have a workforce combined of 43,000 people across our institutions, what does it mean if we just divert 1% of that hire to Westside residents to get them in the door, to get them then engaged in pathways, to help them continue on the trajectory to improve their ability to have a livable wage, to purchase properties in these communities, to invest, et cetera. Other key pieces in that, as Selma alluded to, when we think about the gap and we think about the West Side, a lot of people say, oh, it's the violence. And it's absolutely not. As a leading cause, there are 5 key drivers that cut across cardiometabolic disease, maternal child health, opioid overdose. Homicide is baked into that, and cancer. And so with that, again, healthcare is at the forefront of thinking about how do we standardize care. If African-American women have the highest maternal child health disparity in East Garfield Park on the West Side, how are we creating a standard of care so that as an African-American woman, whether you're in that community or not, you go into one of our systems that you're getting the best quality of care? How do we coordinate care? How do we share data to make sure we're doing a good job? And the same is the case with hypertension management. So again, we can't boil the ocean. And so our focuses are, when we think about access to care, in those 2 spaces. So for hypertension management, what are we doing across our systems to make sure that there is an excellent standard of care that empowers people, that gives them quality engagements across our health systems where they feel welcome, but that they also have the power of healing in their hands through self-monitoring and other key pieces that we deem to be critical in community-based practice. So when we think about what healthcare has stood up to say what they can do as anchor mission organizations by revving up investments, revving up hiring, creating avenues for career pathways, supporting businesses. To date, we've supported over 115 Westside businesses through a small business grant to help revitalize corridors on the West Side. So when we think about the all hands on deck, we think about the city of Chicago and Invest Southwest and their naming and claiming of South and West Side communities. That's a direct connection where we can plug in and make sure that businesses in North Lawndale and Austin and in communities that weren't named in this first round, like Garfield Park, that have the lowest life expectancy, are factored in. When we think about healthy food and a grocery store closing, whose responsibility is that to hold that vendor accountable if they do not act in the best manner by being good corporate partners? It's everybody's. So when Aldi closed on Sunday and it was just open on Friday and they left overnight, community called us. We were connected with the aldermen. We were connected with residents to stand up to say, Aldi, you have to do better, or you owe an explanation. And then the next step is working with the city to acquire the space, to bring in an additional grocer. And while that's happening, to have some type of pop-up where those seniors, those 4 senior centers that are within that radius of that store now have some sort of system in place where they can still access. So that's an all hands on deck example. But for us, it's really about thinking about a comprehensive approach. How do we support the people? And then most importantly, it's not about dictating to community what they need either. When this work began, it was about talking with community and putting them right across the table from hospital executives to make decisions on what the community needed. Not us saying, hey, you need to do this because we have the money, we have the research, et cetera. It's always been an interchangeable process and a conversation where we have on our Executive Leadership Council community members, residents, hospital leaders, making key decisions about how we move and what we provide supports to. Another key piece of the all hands on deck piece is the onset of COVID. 2 years ago, we got a call from the mayor's office with the city's plea to find the best strategy to address COVID mortality and morbidity in Black and Brown communities. And we were able to leverage in this all hands on deck public health. So bringing in our practitioners, bringing in the USC School of Public Health, thinking about community leaders. So in this approach, they are first responders as well, on the ground, providing food, providing PPE, et cetera. We brought them into the table and healthcare to create a strategy to inform how the city would address COVID-19 and mitigate a response. To us, that is what's going to be necessary to really get at what we aim to do by 2030. And the thing is, in the next 8 years, we're not going to meet, or we're going to have to continue to work at uprooting what's been put in place for over the last 60 years. So I think the approach of having healthcare step up and say, like my father said, everybody find what you're best at or what you can contribute and make your community better. It is the same in this case. We need the business sectors that we do work with. We need education at the table. We need public safety at the table. All of these key components that you'll find in communities' quality of life plans curated by LISC to help move the needle. So
there's so much in what you're talking about, Aisha, in terms of, I mean, not just all hands on deck, but just like how you are engaging all the different sectors, whether it's the health systems, the businesses, housing. I mean, you're hitting on a lot of things. And I also appreciate you underscoring, you know, the 60 years of like this issue didn't come overnight. It came over time due to other issues. So let's maybe stick on that comment about engagement, because each of you have covered sort of, these issues that each of your organizations are addressing. They're larger than just government systems. And that's why it's necessary to have additional organizations like each of yours, but each of you also engage others. So how do you go about it? Maybe Selma, for you, how do you engage others to participate with you in Gardeneers?
Well, it's not really too hard. Most people appreciate, one, there has been an uptick in people wanting to grow their own food. There has. And so gardening is the easiest way. If they see one of us in one of these shirts tending to a garden, they usually just walk up and ask us. So that's how we engage our community. But also we rely a lot on our school partners and other community partners. So our school communities are our first line communities. We usually collaborate a lot with our teachers, who are the first line educators in our classrooms. And of course, we collaborate with the administration. And they're usually, if we have a good, and we usually have a good buy-in and investment by that community, they help catalyze other folks within the community. But also we have farm stands where the literal fruits of our labor can be seen by our community. So like I just mentioned, folks see us working in the garden, they ask us questions, but eventually, what are you going to do with this food? We're going to give it away. You should be here when we do it. And then we engage our community that way. Because one of the things we do as an organization is, although we grow foods that are culturally relevant to the neighborhoods that we are in, right? Sometimes we grow things that are a little different. We do bok choy. I never had bok choy until I started working with Gardeneers. I've heard of chard. I don't like chard, but if you do, that's awesome. But sometimes people ask us, how can I utilize this food in my kitchen? And then we tell them. And we also have cooking demos. We have certain days at certain schools where we have workshops, where we have community members actually lead workshops because they are invested in their garden. Although it's the school's garden and we tend to it as gardeneers, the community sees it as their garden. My favorite example of that is Smith Elementary, right there on Blue Island. It's near where the old Abla homes used to be. And so we have a lot of residents that they remember that space when it was a community garden. They remember when St. Ignatius bought the land, and now they know that we are there. And so they still come. And so just one of the ways we engage folks is just by being there. We show up, and when we show up, we are present, and we are there to learn, but also to support where we can. That's how we engage our community, and they see that.
Well, so bok choy, yes. Chard, I'm right there with you on. I don't know how to cook it, and I don't think. But if I got it from the farm stand, I'd learn.
I'm still figuring it out. I think you're supposed to brine it. We're gonna do a science experiment this spring, where we're gonna do it. I had somebody make it in a bruschetta. It still didn't taste that great. It tasted like bruschetta with chard in it, and I'm like, but yeah.
Well, clearly it's working. I mean, changing and adding, one serving of vegetables for the youth that are participating in the programs and learning from gardeneers is pretty exceptional. Maybe we'll even hear a little bit more about leadership. So Linda, if you can talk about just, in terms of the pandemic and what Mujeres has been able to, do, and how you as a leader have had to respond to the growing challenge of violence that you have been seeing.
So I'll probably start with the first part of the question. We have been doing a Latino leadership program for about 30 years. And so we work with women, many of whom have low levels of educational literacy, either from their home country or here in the United States. And once they go through our program, they learn a lot about the fundamentals of running meetings, organizing, how government works here in the United States, and how to make action happen. And one of the things that comes out of that is you see leaders graduate from the program and they become health promoters or community health workers. We call them promotores de salud. And this has been a model that works very well in many communities, diverse communities across the country. We have been using this model, particularly during the pandemic, for vaccine outreach. We've been very successful as many community partners in securing resources to do both outreach as well as referrals for our community to become vaccinated. Since that time, I think when you have community-based organizations working with Black, Brown, and immigrant communities, you see higher success rates. Folks are going to trust the people that are their neighbors, that they see in the grocery store, or they see in church, or they see, in other neighborhood haunts, because they reflect who they are. They see themselves in that. They trust them. And so we help to educate our promotores de salud to provide that kind of information and to do the follow-up. There's still a lot more work to be done for many communities, but this is a model that has proven pretty strong and effective. I think one of the things that we find when we do this outreach is people start telling us other concerns that they have, whether it's domestic violence, or that they're having food insecurity, or that they're having, their child is having trouble in school. What kind of follow-up can we do in terms of that? So it opens the door to other conversations about how our community needs resources, and and it's just great to have people on the ground to do that, because who better than our community to do that? I think the other thing with regards to your second question is, it's a very scary time. And I think that especially in communities like ours, where immigration fear compounded with the pandemic makes everybody very heightened as to their safety and their security. So one of the things that we did very clearly as an organization is talk to our staff about what they're hearing from their participants, but also what their own concerns are about going to work, because I agree with Ayesha that we are frontline workers, many of us. And that we have to be treated as such, given the resources to do the work. People still wanted to come in during the lockdown, but making sure that when we opened our doors back on June 1st, 2020, we were ready to do that, and how we were going to do it in such a way where our staff felt safe. Even with the last surge of Omicron over the holidays, one counselor told me all of her participants had COVID. And when you hear that, you're like, the pandemic is not over for us.
Right.
And so how do you keep the energy going? It's difficult. And I do think that hybrid work is here to stay for mujeres. Because we are working with a professional population that have many opportunities to work in other sectors. So we have to think about being more flexible. So I'm looking forward to, figuring out what hybrid looks for us long term. But one thing that I've said is that we're going to figure this out together. I don't know all the answers. Please tell me when you have concerns, and trying to open that door as much as possible, and provide different opportunities for people to express what they would like to see happen at the workplace.
Yeah, well, I think, you're hitting on some things, and I'd like to talk a little bit more about this. I mean, during the course of this pandemic, it's ebbed, it's flowed. We thought it was over, then, oh, by the way, it sure wasn't. We're still in it, and things are changing. And we've also been dealing with a lot of imperfect information along the way. Maybe Aisha, how is Westside United? How have you led and responded to those realities of uncertainty, but yet continued urgency? And also, how have you had the stamina to, keep that leadership energy sort of front and center?
Sure. I mean, us, like the rest of the world, definitely had to pivot at the onset of COVID. 2 weeks before, in 2020, we had just unveiled our 1,000-day plan for the West Side in person at Malcolm X, close to 450 people. And then boom, we were heading toward a lockdown, dealing with the onset of the pandemic. And so right away, it was a pivot to think about, all right, what do we do immediately, and what are we hearing from our communities? One was from our food pantries, that there was an uptick in what they were providing, almost a 500% increase for food. And so we were able to turn around some emergency grants to support about 11 of them across our 10 communities. Another thing that we did right away was support our small businesses and provide emergency supports there as they were dealing with staffing and other things that they needed to get in front of. We were also looking at people that were engaging in our career pathways programs due to surges at their health systems, folks having to go remote. There were a shift in the way we were able to administer those programs. And so making sure we provided stipends and other things for people who couldn't work. And then we got a call from Mayor Lori Lightfoot to come and help co-convene a racial equity rapid response team. And so we were there bringing together, 6 community leaders, public health, our healthcare partners. And it was not just now a West Side focus, it was a citywide focus. So we were looking at the South and West Sides, where we were traditionally looking at 10 communities. There was an increase there. That was followed by supports coming from the Oprah Winfrey Charitable Foundation to provide supports to 20 Black and Brown communities across 20 communities. And so we went into this intermediary role that we've always served, but that was at the forefront of what we were delivering over the last 2 years, making sure that we were providing supports at that city table, that we were supporting those 20 communities, including our 10 West Side communities. So it really became us thinking about immediate supports in terms of emergency food, PPE, testing. And if you fast forward today, our team is still at that table now in the vaccine equity and education space, and thinking about how we work hand in hand with Healthy Chicago 2025, since that's 5 years away from our mission. When you think about that, it's like, what about my team? What about the people that are administering this work? What about the people who are now at home, that are used to coming and being in the office to access different resources? So we just had to do a complete shift, and we're still hybrid as well. We instituted self-care days for the team. So the last Friday of every month, not much, but just time for us to regroup, to center ourselves, to jump back in, to this massive lift. And over the last year, we've now been more invested in our original workflows. And so that's been a dial back from everything strictly COVID to weaving into things that we were accountable for prior to and coexisting in those spaces. So it's been very interesting also seeing our healthcare partners and the strain that they went through in terms of, hiring, thinking through how to exist and what became priorities there across our supply chains. Businesses that would usually be able to garner contracts were now not primary interest because we had to get PPE and other things in that they may not have been able to provide. So this whole process of shifting and pivoting was something that we really had to get in front of to think about how we would sustain and survive and be able to bounce back during the different iterations of what COVID has done.
Aisha, I'm listening to you and I'm feeling a little exhausted, just, in terms of the magnitude of the different things that you are thinking about and bringing to the conversation and work of Westside United. I want to invite the audience to pop any questions for these amazing panelists into the chat, while we have a little bit of time here. But, with that just sort of in mind, the missions of your organization are dealing with quite significant problems. How do each of you keep your energy up and keep your own sort of leadership, approach during the ebbs and flows of what you've been dealing with? Selma, what's your secret? It's clearly not charred.
No, it's not charred. I love what I do, and I love who I do it for and who I do it with. And so that's what keeps me going every day. I know this work would eventually get done because there are other organizations that do garden-based education. Do they do it how we do it? Absolutely not. But it's knowing that. It's knowing that I know there are lots of people. I saw a meme the other day that said that no generation loves a younger generation like millennials love Gen Z. And it's like, that is me. And I just want to make sure that that generation, at least the ones I come in contact with, they get the love that I know I can give them. And I know my team feels that way too. And so knowing that it's a weird question, who's going to do it if I don't? Is really one of those driving factors on top of the fact that I love what I do. And that's how I'm able to keep going in times like this. It's scary, but also if you're not scared, that might mean you don't understand the gravity of the situation. So if you're gonna do it, you might as well be scared. So
that's very inspiring. I'm inspired by that. Linda, what's your secret?
So I'm a people person. So and many of the things that Selma said resonated with me. We actually closed our office for 5 weeks during the Omicron surge because of just the high rates. And now we're back in the office, and I like seeing people. I get a lot of energy from, our staff. I admire them greatly. Seeing survivors, seeing some of the volunteers that have worked with us, how energetic they are, very passionate about the work. That's just, to me it's just contagious. I also have a dog who basically now lives with my parents, but, just being with, loved ones is, being with family is just super, super important to me. And making sure to keep contact with our loved ones. I think that kind of grounds me in a really, really important way. And I think that when you do this kind of work, it's really important not to be isolated. Anybody who lives in this world should not be isolated. But when you do the work that we do, isolation can be a killer. And it can be very difficult to keep the fight up without kind of having that interaction. So anyone who does frontline work or works in community settings, reach out to your loved ones, your colleagues, and let them know that, what you're going through, because that will help you to power through.
Very, very terrific advice. Aisha, do you have a secret to share with us?
I agree with both Selma and Linda. I have a 6-month-old at home, so he's been a lot of motivation, also a 9-year-old for my kids. But dance for me, being able to unplug and move, create, have that creative outlet to be able to recharge and then, step into the space more invigorated, it is important to me.
Well, those are great. So I want to close out with one sort of, last question for each of you. And this series is really about women in leadership. Each of you is so impressive in terms of not just the work that you do, but how you are leading with a commitment, with a passion, and the impact of each of your organizations. So as we think about the year ahead, after what has been a lot of complexity and uncertainty and challenge of the past several years, what's your sort of best advice or best wisdom that you might want to share, whether it's for the next generation of women leaders or just in terms of what you might be hopefully optimistic about in the year ahead? Aisha, do you want to start?
Sure. So I think it just starts with what we just left off with, and that's finding your recharge, like what's recharging your battery. And that's something that I'm thinking about for my amazing team, because what we were able to do and the pivot that we made, it was amazing, but it also took a great toll. So for me, it's about retooling and sharpening our armor so that we're stronger and better available for ourselves. That will in turn make us better available for our communities. And now that we hopefully have a pandemic under our belt, we're moving forward with knowledge on what it means to pivot quickly, but then also to stay true to our mission and take care of ourselves.
Thank you. Selma, what are your closing thoughts?
I would tell anyone that's leading to remember grace. We are all living through a global pandemic, and as much as we hold ourselves to certain standards based off our lifestyles and intersectionality of our lives, we have to always remember to give those who we are leading, those who we are working with, and those who we encounter grace, even in times when we don't feel like it. But we have to remember everybody is always going through something, but right now, collectively, we are all living in this world that we're all just trying to figure out. And once we feel like, I'm praying that it's under our belt as well, Aisha. I really am. But we just don't know. So since we all don't know, just give people grace. That's what true leadership is to me right now. Still hold people accountable, but remember grace.
Those are very, very powerful words. Linda, what do you have to close us out with?
Hard to top all of that. I would say, in addition to grace for others, self-compassion. I think that's something that's really hard for me to exercise. And I think a lot of folks, it's hard to exercise that. So I think we all need a good dose of that. But I think also when you're a woman leader and a woman of color leader, it's very lonely sometimes. You need to find your friends, your cheerleaders, the people that you can text, the people you can call, like, I can't believe this happened, or this crisis is happening, or this situation, how can I support you? How can you support me? I think, that is something that you need to find throughout your career. But if you decide to take a leadership position, whatever that looks like, find out who your cheerleaders and supporters are, and provide them the love and help that you want from them as well.
Terrific. Well, Linda and Aisha and Selma, I want to just sincerely thank each of you for participating in this conversation this morning. I'm inspired just hearing each of you just talk about the work that you're doing, the commitment, the passion, the impact, why women should be leaders in their communities, as each of you are. So thank you for not just the work that you're doing, but also sharing the stories and the wisdom that each of you bring in today's conversation. With that, Megan, I'll turn it to you to close us out today.
Thank you so much, Lori, for leading today's discussion. And I echo Aisha, Linda, and Selma. Thank you again so much for sharing your time and expertise with us. It's just incredibly inspiring, and I look forward to ways that we can all continue to collaborate. So we have more events in this series, including our very first in-person event since 2020 is on International Women's Day, March 8th. You can stay up to date on that event and others, as well as the recaps for this series at www.hc3. Thank you all so much for sharing your time with us this morning. We'll see you next time.